Okay, so let's talk about the immune system. We're going to talk about the innate immune system first, and then we'll go to the acquired. So in your innate immune system, you have two parts. You have the physical barriers, and then you have the blood-borne. So under the physical barriers, you'll see that you have the skin, and this would include your mucous membranes. Oftentimes, those mucous membranes also have cilia. Your saliva, which has antimicrobial compounds in it. The flushing action of urine and tears. So the fact that you have that liquid flushing or washing off the surface of those, as well as antimicrobial factors in them as well, and sometimes even the pH. Then the stomach acids, because of the very low pH, this is going to be very difficult for the bacteria or viruses to grow in the stomach. Your blood-borne innate immunity is going to be your complement cascades and your a lot of your white blood cells. So these are going to be your macrophages and monocytes, which are your main phagocytic cells. Then your granulocytic cells, such as your neutrophils, basophils, and eosinophils. And those granules have compounds in them that are antimicrobial as well. They'll cause cell death. And then your natural killer cells, which will bind to the infected cell and kill it. Okay, now going over to the acquired. Your acquired immunity is going to be your T cells and B cells. So your T cells are going to be involved in your cell-mediated immunity. So a T cell will bind to an infected cell and will cause perforations in that cell and cause that cell to basically enter into a suicide. So it would cause apoptosis, which is cell death. Then you have the B cell immunity. This is going to be your humoral immunity, meaning that this is going to be where you produce the antibodies. Both your T cells and B cells also have memory T cells and B cells, so that when you get infected a subsequent time, your body will remember the previous infection, and it can cause a more efficient response to that infection the second time around and can take care of it more efficiently. Okay, this illustration here is dividing your acquired immunity into two categories, your naturally acquired versus your artificially acquired. So your naturally acquired, this is going to be on the active side when you get exposed to a disease, and your body can then create memory cells for that disease. So create memory T cells and memory B cells. When you're exposed to it a second time, your body can then mount a better defense because it remembers that pathogen from a previous exposure. The naturally acquired passive, excuse me, this is going to be when the mom passes her antibodies to the baby through either the placenta or through her milk. In your acquired immunity, artificially acquired, you have your active. This is going to be through vaccines. So a vaccine introduces an antigen to your body, and it forces your body to recognize and create memory cells so that when your body comes in contact with that antigen in the future, your body can readily mount an immune response. Artificially acquired passive, you can create antibodies in a laboratory, and then you can inject those antibodies into an immunocompromised individual. So they can introduce this into, for instance, an HIV patient who has a very compromised immune system. They can inject antibodies into that patient. So if this patient is not producing their own antibodies, you're introducing antibodies that were produced somewhere else. Okay, barriers to invasion. So here we're going to start at the bottom and we're going to move up. The first barrier to invasion are your non-specific innate, sorry, your non-specific physical barriers. So this is going to be your skin, mucous membrane, your cilia, stomach acids, the lysozyme and tears, which have those antimicrobial factors, and the act of expulsion. So when you cough, sneeze, vomit, or have diarrhea, your body is forcibly expelling those foreign particles out of the body. Then moving up, you have your innate immunity. Remember, innate means it's naturally occurring within your body. So this is going to be your macrophages and monocytes, which are your Pac-Man cells that go around eating the antigens and infected cells, and your granulocytic cells being your neutrophils, eosinophils, and basophils. This also involves the complement system as well. Then moving up the road in this illustration, you have adaptive immunity. This is going to be your acquired immunity. So this is going to be the cellular immunity, which involves your T cells, and your humoral immunity, which is going to be the production of antibodies from your B cells. So now let's talk about the lymphatic system. So the primary function of the lymphatic system is to produce, maintain, and distribute lymphocytes and other lymphoid cells that promote defense against infections and foreign substances. And the function of your lymph nodes is to filter the lymph and trap those bacteria and viruses in that lymph node where there are a lot of lymphocytic cells that can attack that foreign body and produce antibodies to kill the bacteria. So again, your lymphatic system is going to be involved in the production and distribution of those lymphocytes. And those foreign antigens are taken up into those tissues in the lymphatic system and delivered to the lymph nodes to be taken care of. This illustration here is just another illustration showing the difference between your innate and your adaptive. Adaptive is also called acquired. So in the innate, you have your physical barriers and your internal defenses. And then your adaptive is going to involve your T cells and B cells. And this is just another illustration showing the same exact thing. Sometimes people learn best by seeing different illustrations. Okay. Now your inflammation response. So if you have a cut in your skin, now you've had a disruption of that skin barrier, and bacteria or other pathogens can enter into that wound or that cut. Then your mast cells are going to secrete factors that mediate vasodilation, and vasodilation is going to be increasing the size of those blood vessels, which will allow more blood and blood cells to be delivered to the site of the injury. The reason you want more blood cells delivered to that site of injury is to deliver those innate cell-mediated cells, white blood cells, to this area. So your macrophages, your monocytes, your neutrophils, you want all those delivered to this area of injury, as well as your lymphocytes. So your neutrophils are going to secrete factors that will kill and degrade the pathogens, and then your neutrophils and macrophages will eat the pathogens by phagocytosis. Okay, you'll also have the release of cytokines, which attract other immune system cells to this site to take care of any other pathogens still located in the injury site, and to create tissue repair. The inflammation response is going to continue until the foreign material is eliminated and that wound site is repaired. Okay, so let's go into talking about some of the diseases. Okay, so otitis media, this is a middle ear infection. A lot of times otitis media is going to be inflammation in that middle ear as a result of a cold, a sore throat, or respiratory infection. So you have the nonspecific defense barrier of the epithelial lining of the middle ear that remains intact, and the functions of the mucus and the cilia to trap the bacteria that could be getting in the ear. So this is all functioning fine. Then you have the lymphatic system. Your lymphatic system should be functioning fine here as well, unless you're an immunocompromised patient or you have a previous infection. So if you have a previous sinus infection or respiratory infection, then this could slightly suppress the lymphatic system attacking the problem in the middle ear. You have those chemicals being released, the defensins and the lysozyme. These are both going to have antimicrobial factors. And then you're going to have the neutrophils and macrophages coming in. So these defensins, neutrophils, and macrophages are all your innate immune response. And again, this should be functioning fine unless you're immune compromised or this is a secondary infection. Okay. Cellulitis. Cellulitis is a skin infection. So if the infection leaves the area of the wound and starts spreading out, covering more and more area, then you're entering into cellulitis. Cellulitis in most people, when you have a cut or an injury, it's very, very mild. And in a few days, it's scabbed over, the inflammation is gone, the fever is gone, and you have the little injury wound where the scab is, but nothing else really as far as a problem is going on. You're healing up fine. But if you're immune compromised, such as with diabetes, you have to be extremely careful injuring yourself with any kind of cut where you're breaking that nonspecific barrier of the skin. Diabetes patients have very suppressed immune system, and a slight cut can turn into cellulitis, then can turn into gangrene, and then they can lose an arm, a limb, or even their life. So with diabetes patients, even the slight cut can become pretty deadly or catastrophic. Okay, so let's go through our antecedents here. Our nonspecific defense barrier has been broken. So you've broken the skin somehow, whether it be a cut, scrape, or an animal or insect bite. You've broken this barrier. The functioning lymphatic system, if you are a normally healthy individual, this is working just fine. If you're immune compromised, then you have a suppressed lymphatic system function, and this can cause you some problems. Your innate immune response, again, if you're healthy, this should be just fine. That's going to include your complement and your white blood cells, such as your monocytes, macrophages, and your granulocytic cells. If you are immune compromised, then this is going to be suppressed. Inflammatory response. Your inflammatory response should be working just fine. It shouldn't cause any issues. If you have diabetes or you're immune compromised, this could affect some of the inflammatory response, but usually your inflammatory response works just fine. Your adaptive or acquired immunity, this is going to be your B cells and T cells. Again, if you're a healthy individual, this should be working appropriately. But if you're immune compromised or you're following surgery, or you have another infection in the body, then your adaptive / acquired immunity could be suppressed. Okay, pneumonia. Pneumonia is not usually a problem with healthy individuals. Very seldom do you have perfectly healthy individuals getting pneumonia. Usually pneumonia is a lung infection in immune suppressed individuals. A lot of times it is a secondary infection. So the primary infection a lot of times is going to involve the upper respiratory system. So in the nose, the throat, and then that infection will travel down into the lungs. So in this, you have the bacteria or the virus entering into the lungs, setting up an infection, and this is going to cause inflammation, and it's also going to cause the buildup of fluid or pus in those lungs. You're going to have trouble breathing, and you're going to have trouble with efficient gas exchange because of the fluid buildup and the inflammation. So your nonspecific defense barriers are intact. So you haven't broken the skin, you still have the mucus, and you still have the cilia. The one problem here is that you a lot of times have an overabundance or overproduction of mucus. So that's the one part of that nonspecific defense that's going to be kind of not operating correctly, as you have an overabundance of mucus production. Your lymphatic system, excuse me. In a healthy individual, the lymphatic system should be working fine. But if you're immune suppressed or following surgery, your lymphatic system is going to be suppressed. And that is the reason in the hospital after surgery, they have you breathe into the spirometer to test your capacity, your lung capacity. So are you able to inhale and exhale an appropriate amount of air? If you are showing a decreased capacity, then they will send in the respiratory therapist to give you some breathing treatments to hopefully ward off the possibility of pneumonia. Okay, so our lymphatic system again should be working fine in a healthy individual, but an immunocompromised individual, the lymphatic system could quite possibly be suppressed. Our innate immunity should be working fine in a healthy individual. Again, this is going to be your macrophages, monocytes, granulocytic cells, and your complement. In pneumonia, you have the patient with an increased heart rate. So you'll see them almost having like palpitations. Their heart rate is just very increased because their capability of gas exchange has been greatly decreased because of that fluid buildup and that inflammation of the alveoli. So the body is trying to send blood much quicker and many more times to the lungs to make up for that loss in gas exchange. So they're trying to get oxygen to those red blood cells, and they're trying to pump more white blood cells to the lungs because your lungs are so important for life. You have to have that gas exchange going on. So your body's trying to reoxygenate those red blood cells, but yet deliver white blood cells to the lungs to get rid of that infection ASAP, so not to cause any more injury to the body. So your inflammatory response, a slight inflammatory response is good because remember your inflammatory response is going to call in for reinforcements to help fight off this infection. But once the inflammation gets too great, then you're going to have more and more problems with that gas exchange going on. Plus, you're going to have more of a closing off of the lungs, so less air can get down into the bottom parts of the lung where those alveoli are. Okay, so again, a slight inflammation response is good. Too much of an inflammation response in pneumonia is not good at all, and you'll have to start getting breathing treatments. Your adaptive and acquired immune response, if you're a healthy individual, this should be acting just fine. But if you are immune compromised, then your adaptive acquired immunity is going to be decreased. And if this is a secondary infection, your adaptive acquired immunity can be slightly decreased because it's fighting an infection in a secondary location. Okay, urinary tract infections. So urinary tract infections caused by pathogens entering in the urethra. So down here, the hole leading to the urinary system, and the bacteria, usually bacteria, is going to enter into that hole, and then it's going to travel up to the bladder causing infection. It can then travel up the ureters and into the kidneys as well. So that urinary tract infection can keep going all the way up to the kidneys. The more up it goes, the more serious the infection is. Okay. So some causes of UTIs. UTIs are caused by lack of water intake, because remember, water is going to help flush everything out of your body. If you're trying to hold your pee, so you take a really long trip and you don't want to stop more than once or whatever, that can hold that bacteria in that bladder for long periods of time and allow that bacteria to multiply in that bladder. Improper hygiene. So after you've gone to the bathroom, if you wipe back to front, you can sorry, I lost my word. You can introduce the bacteria from the fecal matter to the area of your urinary tract. And so that's the reason when you're a little kid, they tell you wipe front to back so that you don't accidentally get any of those intestinal bacteria towards the urinary tract. Feminine products. In the female, the respiratory, in the female, the reproductive tract entrance and the urinary tract entrance are side by side. So you are sticking a foreign object in your reproductive tract. But it sits so close to the urinary tract that the pathogens can be very easily introduced to your urinary system. And so that's one of the reasons you always need to change your feminine products very often. You don't want them being saturated and sitting in there too long, because then you can have buildup of bacteria and multiplication of that bacteria. Sex can be the same thing, and birth control, because you're introducing things into the reproductive tract and it sits so close to the urinary tract, it's very easy to introduce pathogens from the reproductive tract into that urinary tract. Diabetes is a big one. In diabetes, you have the buildup of sugar in the urine, and bacteria just absolutely love sugar, so you can have the overabundance or over multiplication of bacteria in the urinary tract. So in our antecedents, the intact non-specific defenses, they still function. So you still have an intact skin, you still have your cilia, so all of that's working fine. Functional lymphatic system. If you're a healthy individual, your lymphatics should be working fine. If you're immune compromised individual, or this infection goes on for too long, then you might have some issues with your lymphatic system. Your innate immunity response should be working good in a healthy individual. So this is going to be the macrophages, monocytes, and granulocytic cells and your complement. If this is a chronic infection, You could have some suppression in your innate immunity just because basically it's getting tired. It's using up its cells. But your immune compromised individuals, they're going to have a suppressed innate immunity. So your cancer patients, AIDS patients, after trauma or surgery, you would have a decreased innate immunity. Inflammatory response. Your inflammatory response in a healthy individual should be working fine. This can cause problems though when you look up here and you see that you have the ascension where you have the bacteria getting into the ureters. If you have too much inflammation here, you can basically close off the ureters and the urine can't get from the kidneys down to the bladder to be expelled. So if you have inflammation that increases too greatly or occurs too long, then you can cause that bacterial infection to back up into the kidneys, which can, if it is allowed to continue too long, can actually cause kidney injury. Your adaptive acquired immunity, again, that's your T cells and B cells. This should be working just fine in a healthy individual. But in an immune compromised individual, or for instance, somebody who only has one kidney because they have had one kidney removed from trauma or donation, they might have a little bit decreased acquired response here. But your immune compromised, and especially your diabetic patients, are going to have a decrease in your adaptive acquired immunity. Okay. Appendicitis. So appendicitis is swelling of the appendix caused usually by a viral or bacterial infection, but it can also be caused by a blockage, usually of a stool blocking the appendix. Also could be caused from tumors blocking the appendix. The appendix then becomes sore and swollen, and blood supply can actually stop flowing to the appendix, which can cause the appendix to start to die. Then the appendix can burst, and then your fecal matter, your waste product, can be released into your peritoneum in the abdominal pelvic cavity. And this can cause serious infection and can cause death. The thing with appendicitis is the appendix can swell and burst sometimes within 2 days. 2 to 3 days, it can swell and burst. So you have to be very, very careful with the inflammation of the appendix, because the last thing you want is that fecal matter getting out into your peritoneum. Okay, so intact, non-specific defensor barriers. If the appendix hasn't burst, then this is still intact. Your lymphatic system, if you're a healthy individual, your lymphatic system should be working just fine. Let's see. Your innate immune response, this is going to be the macrophages, monocytes, and granulocytic cells, as well as your complement. If you're a healthy individual, this should be working optimally. If you are an immune compromised individual or a diabetic patient, then this is going to be suppressed. Your inflammatory response, if it's a slight inflammatory response, it's a good thing, because remember, your inflammatory response is a call to arms. You need all hands on deck to help fight the infection. But if the swelling is too much, then the appendix can burst, and that can cause a world of issues with all the leakage of that fecal material into your peritoneum, and it can cause death. Your adaptive acquired immunity, this is your T cells and B cells. It can be working appropriately if you're in a healthy individual. The problem is remember I said that it could burst within 2 to 3 days. Well, a lot of times your acquired immunity takes a couple of days to kick in, and you may not have a couple of days to wait. So this is very iffy on whether this is even going to help with that appendicitis. But if you are a healthy individual, your acquired immunity should be fully functional. If you are an immunocompromised, or you had some trauma or following surgery, or you have diabetes, then your adaptive immunity is going to be suppressed. Okay, for major trauma or even a sprain, the first thing that's going to happen is inflammation. And remember, inflammation is going to cause those mast cells to release cytokines, which will cause vasodilation, which causes the increased blood flow to the area. So it's going to deliver those white blood cells and red blood cells to that area to try to take care of any bacteria or cellular debris, damaged cells in the injury site. Then you're going to have the repair and rebuild of the damaged tissues, and then you'll have the remodeling and strength training or physical therapy. Okay, so let's go through our antecedents. The intact, nonspecific defense and barrier. If you're having a severe trauma, this could be compromised. But if you're having a sprain, this is going to be fully functional. This is not compromised. It's the tissues underneath the skin that have been compromised. So a sprain, a lot of times you're damaging deeper tissues. Your lymphatic system in a large trauma, the lymphatic system will be suppressed. In a healthy individual, slight trauma, slight sprain, this is going to be fully functional. In your innate immune response, this should be fully functional in a healthy individual, and if the trauma is not too significant. If the trauma is very significant, or if the patient is immune compromised, such as a cancer patient, HIV, or diabetes, then your innate immune response will be suppressed. Inflammatory response, you're going to have an inflammatory response to a sprain or trauma. And remember, that's a good thing, because you want to signal to other blood cells that you need help, at all hands on deck to fight the problem. But this can cause some problems. So if you've had trauma, for instance, to your throat area, and you start having swelling there, it can cut off your airway, and they could have to do a tracheotomy or intubate you. So as long as the inflammation doesn't get too out of control, then it should be fully functional and helpful. Your adaptive acquired immunity, if you're a healthy individual, this should be just fine, unless it's a severe trauma. And then in a severe trauma, it might not be able to keep up with the amount of work to be done. But if you are an immune compromised individual, this adaptive immunity is going to be decreased.